Great. Well, thanks for inviting me today. Appreciate it. My name's Steve Clark. I'm with Ohio Health Benefits. We have an office in Hiram, and we have our office in Talmadge. Thanks to Brad Cromus for inviting us out here and to participate. So we're going to be pretty loose today. We're going to talk about, the main two topics are going to be Medicare 101, and then also we'll talk about and touch base on the Affordable Care Act and for people who are under age 65 who need help with health insurance. Certainly, because this is a financial wellness fair, we do occasionally run across people who haven't really thought through the medical side of things, and therefore they may have planned for their retirement, they know about Social Security, they know about their 401k, and they have all that part figured out, but they hadn't spent much time thinking about the cost of the medical side of things and the insurance side of things. So we'll touch base on that today to kind of give you a general overview of it. So we'll talk about the confusions of Medicare, a little bit about the basics of Medicare. We'll talk about our team, our small group division, our individual division. Future sessions we do in our office in Talmadge. We do Medicare and Muffin sessions. Right now, because it's open enrollment between October 1st and December 7th, we've got a lot of people who want to look at their plan options, so we do Medicare 101 sessions. But we also do sessions for employers as well. A lot of large employers in the area want help answering questions for their employees, and we'll do that as well. And that's just, we're a phone call away for scheduling something like that. So Ohio Health Benefits, OHB as I like to refer to ourselves as, we were founded in 2004. Myself, Steve Clark, and my business partner at the time, Dave Auble, started it. He and I both worked for Anthem Blue Cross and Blue Shield. And we were at Anthem Blue Cross Blue Shield, and I pretty quickly learned that I did not want to be a captive agent. So when you work for an insurance company, you're charged with trying to sell their products. And so it was a little bit of a moral or ethical dilemma if you're saying, hey, if I go to somebody's house to help them with a plan, I only get paid if I can sell the plan that the company represents. And so I learned pretty quickly that I like the industry, I like the business, I like helping people, but I didn't want to be a captive agent. And Dave was of the same mindset. So we started in 2004. June of 2004 was when our tax ID came into an existence. I said to Dave, I said, if I'm going to start my own business, I want to work close to home. And Dave said the same thing. So because of that, we started with 2 offices, and we still have 2 offices today. Fast forward to now, 2022, Dave has officially retired and gone on to other things. I bought his part of the business out. We're at 38 employees. We have over 13,000 clients right now. We're adding clients at a rate of about 1,200 to 1,400 per year. And so we've had very good growth.
And there's still an office in Hiram?
Still have the office in Hiram.
Yep.
Yep. And we do visits in Hiram as well. Yep. We do make house calls. So because Medicare is confusing, you can go to people who are looking at Medicare options can go to sessions where, say, Humana's putting on a session, or Anthem's putting on a session, or SumaCare. Those sessions are meant to enroll people in very, very specific plans. We don't really do that. We do educational sessions like this, but when it comes to helping somebody make a plan choice, then we're doing it usually one-on-one, or maybe 2-on-1, maybe a husband and wife. So we'll do calls we'll meet people at our offices in Talmadge or Hiram. We'll go, to a Panera or a Bread or a McDonald's or a Wendy's. We'll go to people's homes. Luckily, with COVID kind of chilling out a little bit, we're able to do that more often. So we do enjoy meeting people face to face. There is no charge for our services. So the nice thing about this business is to be able to have products and represent products and represent all the different companies, yet we don't have to charge for our services. So I say if you call Humana up, they're going to want to sell you a Humana product. If you call Anthem up, they're going to want to sell you an Anthem product. But if you call a broker, an independent agent like us, we act like and represent more of you, the member, rather than an insurance company. So because the insurance companies pay us for enrolling people, we don't have to charge you for the services. The other thing about it is human nature would say, well, if I could go right to that insurance company, I'd probably get a better deal for the plan. Well, luckily it doesn't work that way. The rates are all determined by the insurance companies and through the state of Ohio and CMS, Centers for Medicare and Medicaid Services. So a plan that you get from a broker or direct from the insurance company, there's really no difference in the price of the plan. So, 2021, we were voted by the Akron Beacon Journal Best of the Best by our clients as Best Insurance Company. They didn't really have an agency division back then, and Best Customer Service. And then in 2022, we won the Best Insurance Agency category, so they changed the category to Insurance Agency, which is more accurate about what we do. And we also won the Customer Service, and my employees surprised me with nominating me for Best Boss, so I got to wear the crown of Best Boss for 2022. So the big thing about health insurance is confusion, right? We hear this all the time. People that are trying to figure out health insurance don't know what to do, right? And even before I was in this industry, I was working for a company and I complained about the health insurance. You know, I felt like my employer's taking more money out of my paycheck every month or every year. And, you know, the co-pays were going up, and the deductibles were going up, and I didn't really even know what they were because I didn't use it too much. But the main thing is it's confusing. If you're going on Medicare, you know there's added confusion because the mailbox starts to fill up with papers and flyers and stuff that looks like legitimate information that looks like it's government sponsored when it's really not. Your phone starts ringing, so you're getting calls from people, and you're getting stories, and you're getting advice and opinions and direction from family and friends and neighbors, and it's just this whole confusion about Medicare and health insurance in general, including the Affordable Care Act. So our job is simply, you know, to try to take the confusion out of it. We don't make people experts in the products. We're the experts in the products. We make sure you understand how to use it and get into a good plan. So here's the big number. When I got into business in 2003, was when I went to work for Anthem. In 2004 is when we started the agency. The number that we hear is this big 10,000 people a day, right? So because of this baby boomer generation aging, I'm one of them. I'm born in 1963, so I'm on the other end of it. But there's 10,000 people each day in this country turning age 65. And it is like a bell-shaped curve, and we're kind of at the top of the bell right now. So because of that, because of the number of people that are turning Medicare age, there are more and more agents and companies in the business. So that adds a little bit to the confusion as well. When I first started in 2004 with my agency, and I went to the first United Healthcare meeting where they were allowing brokers to sell their products, they had one meeting up on Rockside Road in Cleveland, and there was probably 7 or 8 agents in the room. Fast forward today, United Healthcare will hold those same meetings. They have big hotels they hold them in. They'll do 5 or 6 sessions, and there'll be a couple hundred people in each session. So just a lot of agents and a lot of people getting into this business. It's very easy to get into this business. You need a license, a phone, and a computer, and you can get into business. It's a little bit harder to grow a business like what we've done, but to get into business, it's easy for sure. So people are working beyond age 65. This is a big thing, right? If you're getting ready to turn age 65 and but you're still working and you don't know what to do, we help a lot with conversations around that subject. In general, if you ask your family and friends, they will say you better enroll in Medicare when you turn age 65, regardless of the circumstances, because if you don't, you're going to face penalties. And many times that is not the case. So one of the first things we're doing is calming people down, like, no, you don't necessarily need to do that. Let's talk about your situation. Let's find out how you're covered. Let's find out how long you're going to plan on working. Let's find out if the coverage is that you have is through your employment or your spouse's employment. And is your spouse younger or older than you, and things like that. So the working beyond age 65 makes it even more complicated. But it's not true to say at age 65 I must enroll in Medicare. That's only true if you don't have any other access to health insurance. But if you're covered by an employer, it's more complicated than that. If you're a high wage earner, you pay more for Medicare. People are afraid of penalties. And so we just really explain all that and help people out. This is a good slide here. So the national average for Medicare Advantage plans in the country is 39 plans per county. That's the national average. Well, for some reason, and I don't really know the answer to this, Ohio is a hotbed for Medicare plans. And in fact, Summit County, Ohio, I know we're in Portage County, but Summit County, Ohio leads the country in the number of plans available. And with 82 plans available in Summit County, Ohio, and then Portage is a little farther down, 73 plans available in Portage County. So way more than the national average, but that adds to the confusion as well. We don't need 82 plans or 73 plans, but there are that many plans. So I got this kind of funny slide. I put this mustard thing up here, and I did a little research. When I saw this slide about the number of plans, I said, well, you know, how about mustard, right? How many different plans or types of mustard can you buy? And so I Googled, I went on the Meijer grocery store website, and I just put in mustard, right? And if you put in mustard in the Meijer website, how many mustards do you think that are available in the website from Meijer's? Yeah. I usually get numbers like, you know, a dozen, or maybe there's 15 or 20. There's 103 mustards that you can get from Meijer's. So you have all those choices. Well, so I told you there's 82 Medicare Advantage plans, but there's also if you wanted to buy a Medicare Supplement Plan G, there's another 67 Supplement Plan Gs out there from insurance companies. So when you add all that up, it's more than the number of mustards at Meijer's. So a little bit of a fun slide there. So Summit and Portage County are in the top 8 in the country. There's many Ohio counties. You can see all the counties in blue. Ohio leads the most counties across the country, and you know, again, locally, Northeast Ohio leads the country as well. So there's a Medicare card. The parts of Medicare are Part A is hospital coverage. Part B is doctor coverage or outpatient coverage. A few years ago, they went and got away from using Social Security numbers, and now they use these random numbers, or this, a series of letters and numbers for Medicare numbers for people for security purposes. The current rate is actually this. So the current rate today for Medicare Part B is $170.10 a month, but next year it's actually going down to $164.90. Medicare A is free. Yeah, so high fives, right? That's the first time I've seen that in the 18 plus years I've been in the broker world. And you're getting higher than average Social Security, right? I think the Social Security increases are supposed to be like 8%, so that's going to feel pretty good. Although it doesn't feel good paying $4 for gas, but anyway, the Medicare Part B premium is going down. So the main parts of Medicare are A and B. A is hospital insurance. B is outpatient and doctor insurance. So, depending on your circumstances and what you need to do, we will help you decide: do you need Part A or do you need Part B or both, or can you delay it? And if you're working for an employer and you have employer coverage, and the employer has more than 20 employees, you can delay your A and your B. And if your employer offers a health savings account plan, an HSA, a high deductible plan, you definitely should delay your A and B, because if you don't delay your A and you enroll in it, then you can no longer make valid non-taxable contributions to an HSA account. So we do meet with a lot of people, and the advice at the end is, hey, don't do anything, or yes, enroll in Part A only, or maybe enroll in Part A and B. If you're working for a small employer, under 20 employees, you would need A and B. But that's more the confusion. But once you decide to get on Medicare and leave your employer plan, or maybe if you're not working, you're self-employed and you're ready to get on a Medicare plan, then when we meet with people, we spend the most time really talking about this slide here, which is Path 1 versus Path 2. This is where a lot of the confusion comes from. This is the Jimmy Walker, the Joe Namath, the Medicare Martha commercials, right? They're talking about, those commercials in particular are talking about Path 2, Medicare Advantage plans. But anybody who gets enrolled in Medicare, they really have a decision, do they go down Path 1 or do they go down Path 2? And so when we sit down with people, and usually even before we meet with them, we're asking questions like, you know, give us a list of the medications that you're using, tell us what doctors you like to see or need to see, what hospital system do you want to work with, maybe tell us about your travel habits, are you a snowbird, do you travel out of state a lot, kind of thing. And then we gather that information, we'll do a little bit of digging and analyzing. We'll go to the Medicare website and do some analysis and look at those 80-something plans out there. And then we'll meet and we'll talk about, all right, here's Path 1 and Path 2. And so I won't go over this in detail today in the interest of time, but I would say that, you know, in general, it is two different ways of getting Medicare. Path 1 is you use your Medicare card and Medicare pays 80% of the claims, and then you buy a Medicare supplement plan, and Plan G is the most popular plan, and the Plan G picks up the 20%. Plan G also picks up the hospital deductible, which is $1,556. So if you do the left side, you carry a Medicare card in your wallet, you carry a Medicare supplement card in your wallet, and then there's something called Part D. Medicare Part D, even though it's called Medicare Part D, you don't get it from Medicare, you have to get it from some insurance company, and that's a third card you carry in your wallet. So if you do the left side, you got these three cards in your wallet. Your Medicare card paying 80% of the claims, your supplement card picking up the 20%, and then your prescription card that's helping to pay for prescription medications. And most of them will have copays. Or if you do the right side, you do a Medicare Advantage plan, you actually don't carry your Medicare card. When you do, if you do, and when you do a Medicare Advantage plan, and this is the number where I said, hey, there's 82 plans in Summit County and 73 plans in Portage County. When you do, if you do a Medicare Advantage plan, you're signing a contract or an agreement that says you're going to use the insurance company for your Medicare. And so when you hear about these plans, there are many, many very good plans that have zero monthly premium. And so when I say that, people get an inquisitive look on their face, like, how can a plan be zero monthly premium? How can I get this from some company and not pay anything for it? And the answer is very simple. You're not paying for it, but the government is paying the insurance company to handle your Medicare for you. So Path 2, which is also called Part C, which I say Part C stands for confusing, because I don't know why they call it Part C, you don't get it from Medicare. But it is a Medicare Advantage plan. If you go down Path 2 and you enroll in a Medicare Advantage plan, or the Part C, then you won't use your Medicare card anymore. You still have to pay for your Medicare card though, so you still got to pay that $170, that $164.90 a month that they're taking out of your Social Security check for your Medicare, but you don't use the card. And the thing about these plans is the insurance companies get paid a lot of money from the government for people to be on their plans. The national average is between $700 and $900 a month, every month for every person on the plan. So that's why, you know, Joe Namath is running the commercials. That's why Medicare Martha's out there. That's why your mailbox fills up with that stuff. All of these insurance companies are trying to get your attention to get you to sign up for or enroll in their plan so that they can get that government money. So the good news for the insurance company is if they can convince you to go on one of their plans, then they get that stream of government money coming in. It doesn't matter how much you use the plan, they're just getting that fixed amount. So the good news for the insurance companies, they're getting all that money. The bad news is they take the risk. So if you did have to, and I tell you, you don't use your Medicare card, but you forgot and you used your Medicare card and you went to the hospital and you had a $100,000 bill and it went to Medicare, they would reject the bill. They would bounce the bill back and say, don't send us the bill, send the bill to the insurance company, Anthem, Blue Cross Blue Shield, or AARP, or Sumicare, or Humana Gold Choice, whatever. Because that insurance company, they have to pay the claim. So the insurance company is getting paid by the government to handle the Medicare, but they're also taking all the risk. So the big thing about these plans and these commercials you're hearing is there's certainly a lot of money in these plans, and the insurance companies are doing very well. And you know, if we enroll you in one of these plans, even though you don't have to pay for the plan, we get paid. Brokers and agents get paid. So there's money in the business. Well, because they're doing well, they've gotten, what I've seen over the last, several years, and really in the last 4 or 5 years, and it seems like in the last 2 to 3 years, these plans have gotten much stronger with extra benefits that they're advertising. And that's what those commercials are about, where they say, hey, I get dental, or I get hearing coverage, or I get vision coverage, or my plan will give me transportation to and from doctor's appointments. Over-the-counter cards are a big thing now, where some of the plans will give you $65 or $70 or $75 every quarter that you can use for things like vitamins and Band-Aids and Tylenol and cotton swabs and things like that. So it's the insurance company getting that government money. They're doing fine, they got plenty of money, so now they're saying, hey, what extra stuff can we throw on top of these plans to try to get people to jump on the plan? Mm-hmm. And so Papa Pals is a big one. There's a couple companies that offer Papa Pals. I've had a few of my clients where that you can call up and have somebody come to your house, and they could simply sit there and watch TV with you or help you program over remote. Or I had a lady say, hey, I had this kid come over and he helped me trim my bushes, or rake leaves, right? And that's just part of the benefits, and people love that stuff. So that's how those work. And if you're considering that path, we've got to figure out, which plan we would recommend. And again, doctors and hospitals and medications dictate that. So how do we help you figure that out? Gather information on your situation, schedule a meeting to discuss the options, and sit down with you and do an analysis and figure out, hey, this is a plan I would recommend because of, you said you go to these doctors, you use these prescriptions, maybe you have a home in Florida or not, or you're a snowbird or whatever. That's what we do to figure that out. So we do have a support team, so people that each year as plans change, we support our products, we support our clients. We have a whole in-house customer service team of licensed agents that can talk about the plans and answer questions. And if there's some disruption in the market, if the plan you're on for some reason doesn't look good next year, we can give you a call and say, hey, we need to meet and talk about new plans for next year. So we're doing a lot of that now because it's open enrollment. We have until December 7th to get those plan changes done. You get a lot of advertising too. I'll brush on this quickly, and then because we're bumping up against the end here. We do also help people in the individual market, so people who say, hey, I'm retiring at age 60 and I need to get insurance, or I'm in between jobs and I need help with insurance. We are licensed, we are certified, we can represent and sell Obamacare or Affordable Care Act plans. We can compare those plans to COBRA. A lot of times COBRA looks better, but we'll help figure that out. The subsidies on the market have increased a lot with some of the stuff that the Biden administration has done. Now a family of 4, you can earn up to $150,000 and still get government money to help pay for the premium. A retiree couple in their 60s can earn up to $200,000 and get subsidies. That used to be about $90,000, now it's $200,000. And so we'll help people figure that out. How can we help you? We are licensed with all the major carriers, so I mentioned a few, Anthem, SumaCare, United Healthcare, which is AARP, Oscar, Medical Mutual Ohio. We are not salespeople, we are consultants, we are advisors. We don't call ourselves salespeople. We're licensed and agents, but really it's about helping people figure it out. Many times after we're done meeting with somebody, we may say, hey, go on your retiree plan, go on that STRS plan or OPRS plan, or go on your spouse's plan or not. And then when people say, hey, what do I owe you? The answer is, well, you don't owe us anything. But just put our name out there, right? Tell people about what we do. We do keep up with the changing markets. There's new plans entering. There's one called Devoted Health. You may have seen the ads for that. We're really high on that plan this year. Generally, we don't mess with new plans a whole lot, but that's kind of an exception one. We do annual reviews. There's our team. We're 38 employees now. These are our licensed outside agents. And then we have a whole other team of inside agents they handle customer service and they handle reviews and things like that. And there is our building in Talmadge. It does have an upstairs. You can't really tell by this, but there is an upstairs. So we're slowly filling the building up. We're about 70% filled. We built the building 5 years ago, and we're feeling a little crunched already, but it's been good. So, and then there's some of the carriers that we do there. So, let me give you guys a card. I've got just a little card on us. I think I brought them here. You got any questions for me? Thanks for coming.
Well, we're already there.
You're already there.
I'm on OPRS.
You're on Oprah, so you're getting some money, right, to help pay for it?
Yeah, but it's still confusing because I still get all that stuff in the mail. But if I switch to an Advantage plan, then there's a possibility I could never go back on the Medicare.
Yeah, so do you know the rule on that?
I don't know, I couldn't state them.
So the rule is, who's your supplement for now? AARP or Medical
It's
Mutual?
Anthem.
Anthem, Medicare supplement? What, a G? Okay, so you get one time in your lifetime, if you left that Anthem supplement and you went to one of the Medicare Advantage plans, you get one 12-month window. If you change your mind, you could go back to Anthem and not have to answer any medical questions, and you'd be guaranteed that coverage. So there is this, they call it like a free trial period, or 12 months. So if you do it, say you do it now, and in January you go on a Medicare Advantage plan, and then you're nervous in July, like, oh, what did I do? Or even if you get some bad news, like, oh my gosh, I got some really bad medical news, I want to go back to my Anthem supplement. Well, you can do that. It would start the first of the following month.
Yeah.
But after 12 months, then you get into the next year, you can only make that change during open enrollment, and you have to answer those medical questions. And I said the questions are things like, do you need a joint replacement? Do you have a pending hospital stay? Do you being treated for dementia or Parkinson's? Are you being treated for cancer, heart conditions, things like that? So if you say yes to one of those questions, and each of the insurance companies have different questions, all they're similar, then they can say, we won't take you. Like Anthem can say, we won't take you back. So you get the one-time 12 months.
So I'm better just to just stay here because I've got a lot of things wrong with me.
Yeah, and the fact that, OPRS is help paying for it. Right?
And they're helping pay for it.
Yeah.
But,
and you don't have a network, right? So that, with the supplement plan, you go to any doctor, any hospital, anywhere in the country, they'll take a Medicare card. With the Advantage plans, you got to stay within the network.
and he has just gone there and he has devoted.
Oh, yeah. You did a devoted plan.
But we've only had it for
a couple of months.
Oh, yeah.
So he has to see if it's still.
Are you on the Part B give back plan?
Do you know?
So they got a plan next year that'll get you $150 back of your Part B premium every month. the co-pays are higher, the out-of-pocket costs are a little bit higher, but they will do that, so.
So you need.
It'd be worth looking at. I mean, they've done a good job. You've only had a couple months.
But they, like, they give
September.
250 a quarter,
Been over the counter?
240 or something like
a lot.
Oh, yeah,
that. It was quite a bit.
yeah, more than you can use, right? Everybody says, oh, I'm giving it too much.
No, I don't know, I got like $40 left.
Yeah, you're doing okay.
Everybody's getting Tylenol for Christmas.
Yeah.
Yeah. You shouldn't do that, but it's like, you lose it if you don't use it.
Tylenol, yeah, right.
Anyway,
No, I talked with Dave Mander down at Dunwich, so.
Great, well,
he's my
thanks.
contact.
Yeah, Dave's a good guy. Yeah, he's on there.
and he told me
Did you do your devoted through Dave?
he did.
Oh, nice.
He didn't, I didn't do mine through him.
Well, you couldn't because of.
But he
Opers.
advised
Yeah,
me that,
Yeah, we
yeah.
do that a lot, you know. Yeah, because you don't want to give up that Opers money,
No,
although it can be a pain dealing
although
with
it took
those.
me, I don't have the full amount because I was in that gap before they started paying into Social Security.
Mhm.
Oprah's started at a certain year and they're supposed to, grandfather a bunch of people in. but
Right.
They didn't.
Oh, yeah.
So I was 1/4 short of, 'cause I worked other places, but I was 1/4 short of 40.
Wow.
So I had to work. I've been retired since age 53 and I'm 68.
Wow.
So I got a job
You
after.
got more quarters. You
I
got.
finally have 40, but I just got it, so I'm waiting on them to decide whether I can get the full amount or not, but I will. It's just waiting on Social Security to
Yeah.
answer back.
Huh.
But it's been a pain. There's been a lot of people that were in my same position, so.
Yeah. Kind of filling the
But,
gap there.
and they might not have even had close to 40, but I was lucky to only need to get 1/4 extra, but it's like, it's confusing so much, and I worked for the government welfare department, so I know you have to jump through the, like,
Yeah.
he's had problems and figuring stuff out, and it is very confusing. I wish they wouldn't send me all that stupid mail, I just don't wanna have
Yeah.
to.
it's confusing.
And the
Yeah, it's more
commercials
confusing.
are, you think, oh, well, I should do that, or I should do this,
We
but,
get that all the time. People forget that they have all that extra stuff. Well, people calling in saying, hey, I want that extra stuff. I had to call yesterday. The lady's like, well, I want dental. I said, you got dental. Your plan's got $1,500 in dental this year and $2,000 in dental next year. And so make sure your dentist is in the network. We check the dentist is in the network.
Yeah.
And then they had a flex card. You get a $500 flex card. Like, you could get this. So she had all these benefits. She just wasn't using them. Didn't know
right,
about
so
them,
she didn't
forget about
remember
them.
that she had.
Yeah.
Yeah.
So I guess the commercials are good for that because it's creating that
We
noise.
kind of like this devoted thing because it's doctors that started it,
Yeah.
and,
So yeah, and the Ed Park and I can't remember the other guy's name. They're Cleveland-based people too, but they do a really good job.
yeah. So it did help to clarify some of that for me, did it you?
Well, good.
So,
Good.
thank
Yeah, we only had they gave us a half hour. Generally, I do something like this in an hour.
Yeah.
So it's like I gotta but and we had to talk about ACA, but no,
It's
I enjoy-
interesting.
I enjoy
mean,
doing it.
Next year I'll still need, I won't remember. Now, what did they say I should do? And then I start looking at my stuff because OPERS will, like last year, they will help you decide if you should change your D or not.
Oh yeah.
And I called up like in 1st of September to get an appointment for that and they were booked up the whole rest of the open enrollment
Yeah.
period. So I was left to figure it out for
That's
myself.
the pain about that.
Yes,
Yeah.
it is.
Just too many people.
Now, it'd still be good for her to go and talk to one of your agents just to see if she's in the right plan, correct?
Well, you can't really change. You have a G? You said Anthem G? Yeah.
Only for the D it changes.
Yeah, the D.
But
Yeah,
I
the G,
still had
you really don't want to
200
jump from sub to
No.
sub.
But I had 240 choices for my D.
Yeah.
I can't figure out which one of those to take.
Right. Yeah, right.
I mean, and I'm not, how do people that can't figure it out?
Yeah, I don't know.
Anyway, thanks for all your time.
Yeah, well, thanks for stopping in.
Is